Are you a mom who's nearing your due date or nearing your scheduled induction and you're really hoping to help your body get started into labor on its own? I'm here to help. Hey moms, I'm Dr. Shaunna Mason. I'm a board certified OBGYN, helping moms know more about their body as they get ready for labor, feeling more confident as they have their babies, and having an easier and smoother recovery postpartum. It comes up all the time in the office. What can I do to help get my body into labor? And while it is my belief that babies come when they want to or when we tell them they have to, there are things out there that can help with some of the preparation for the body to get ready for labor. And I think the hurry up and wait at the end, not knowing when this baby's going to come and feeling like there is still so much time passing without the baby coming, can be really hard for families. So even if these remedies don't actually kick you into labor, I think they are so good at helping with the mental energy of feeling like you are doing something to help your body have this baby. And as an obstetrician, I can promise you, you will not stay pregnant forever. At some point, you will have this baby or we will help you. So what can you do while you're waiting? I think something that has some good research behind it and is certainly great for our bodies is movement. So anything that you can do to keep your body moving. Think about walking and stretching and sitting on your birthing ball. All of these things we think help jumpstart labor because we are using gravitational force and movement, which allows your pelvis to move around and shift. And these things can help settle the baby down into the pelvis and give us some strong pressure on the cervix, which can help release the chemicals we need to get things started. Also, exercise can help increase some of our hormones known as relaxin, which really helps our joints loosen up so that our pelvis can accommodate pushing out a whole person. We really need those things to happen. And while they happen naturally, we think movement can also help support the body, encourage it to do what we need here at the end. So think about walking 30 minutes, getting your heart rate up, going the distance, and as you hit the pavement step by step, your pelvis is shifting a little bit and that baby is settling a little bit lower. Think about different yoga positions. There's great prenatal yoga videos out there, and it just opens up your back and your spine and your pelvis. All these ligaments and joints can start stretching, and that may be exactly the position your body needed to then settle that baby down in there so that we can get the pressure we need from the baby's head. And curb walking, that's become really popular. And this can be accomplished on stairs too, if it's too cold or too hot for you to be outside walking on a curb. But we think this asymmetric tilting of your body, if you're 1 foot up and 1 foot down as you walk, is just jostling your pelvis open and shifting things the way we may need them to get that baby to settle down in there and to potentially release things like prostaglandins and oxytocin, which are our labor hormones that we need to kickstart contractions or strengthen the little baby contractions we're maybe already having. Okay, next is food and drink. There are tons of remedies out there on the internet that you can find that can tell you to eat spicy food or drink this magical Starbucks drink. And while I don't know if any of this stuff helps, I don't know that most of it is very harmful. So I think it's very good to try. I think all my patients were eating this labor lasagna for a while, and right now there's this magical Starbucks drink everyone's drinking. And I think these things can help. The reason we think stimulating the GI system sometimes can strengthen contractions are these organs are all living right together. Your uterus is enlarged, your intestines are pushed all out of the way around each other. And if they're working hard, processing something they may not be used to, then maybe there's referred agitation at the uterus, and that will strengthen contractions or jumpstart them. I also think there are things like raspberry leaf tea and dates and pineapple that have some evidence that maybe they help soften the cervix. So if we're walking and we're softening the cervix and we're getting all of that pressure we need, that may be the perfect combination to kickstart your body into labor. I think there's lots of support for things like acupuncture and acupressure, certain types of massage or pressure points people believe can jumpstart labor. I think if you are working with a provider that you really trust, that has experience in this, then I think this can be a very safe way where you feel like you're doing something. I also think acupuncture can be very relaxing for the body. And like I said, the mental stress of just not knowing when the baby's coming can just drain all of our energy. And we need energy all the way to the finish line to get our babies out of our body one way or another. So I do think massage and acupressure and acupuncture can be really helpful in relaxing certain muscles and maybe even getting some things started as far as the uterus goes. Okay, let's talk about contractions. We know we need them. Contractions are what we need to get this baby out of your body, to get the cervix dilating, to get us to 10 centimeters where we can start pushing, and then to help us push that baby out of your body. So what are some things you can do that may help start or strengthen contractions at home? One thing is sex, or more importantly, orgasm. So we think that having orgasm is going to contract the muscle just like contractions will. So if there's already some chemicals around like prostaglandins and oxytocins that are maybe bouncing off these receptors in the uterus, and then you organize a contraction through an orgasm, then sometimes those receptors will sort of overstimulate, and the contractions that maybe you've been having will now hang around and stay stronger. We also think if you're having sex with a male partner, there are components in semen that might help also soften or ripen the cervix. So it can be just stimulation and orgasm, or intercourse as we know it with a male-female partner to help get things started. Now, that may not feel ideal for you because things are really swollen and uncomfortable, so this is definitely personal preference. Also think about nipple stimulation. So when we stimulate our breast, when we are breastfeeding, the hormone that releases the breast milk that our breasts have stored is known as oxytocin. And this is the same hormone that we need to strengthen contractions. And so stimulating the nipples, either through pumping or just self-stimulation, can build up the oxytocin your body knows it needs to release in order to breastfeed, and that will apply to the receptors in the uterus as well, and hopefully strengthen those contractions. So that is why pumping and nipple stimulation can really help strengthen or jumpstart contractions in early labor, and maybe just the key you need to transition you over to strong, active labor. Okay, lastly, let's talk about the membrane sweep. So this is a mechanical stretching of the cervix to help release our own prostaglandins that we know our body needs to both continuing softening or ripening the cervix, as well as to jumpstart some more contraction. So I've got some models here. So when we do an exam in the office, we are reaching into your pelvis and feeling for cervical dilation. Okay, and so when the cervix is a little bit dilated, then we can actually feel for the baby's water bag sitting above that. So if I take my fingers out, there's your baby's water bag right there behind the cervix, and we can reach in and feel that. Your baby's in this water bag, and there's your cervix inside your pelvis. So whenever we do a membrane sweep, what we are actually doing is trying to separate the attachment of the baby's water bag from our attachment of our cervix and our uterus. So light purple is cervix, dark purple is uterus. These are separate but cohesive organs, and they work together to help us get your baby out of your body. So when we reach in to do a membrane sweep, again, cervix, uterus, water bag, we can see it there with your baby's head sitting right behind it. We are taking a finger and trying to separate in a circular motion the attachment of the baby's water bag from the cervix. So we just separate it just enough. Our goal is not to break the water, although if there's a lot of tension there, that can happen. Our goal is to simply sweep away that filmy attachment as far as we can reach around your baby's water bag to help release your chemicals known as prostaglandins to help strengthen your contractions. And this is why doctors will offer membrane sweeps after 39 weeks to try to naturally release some of those prostaglandins, just as you would at home with these other things we've talked about. But it's something we can do in the office with an exam that feels like a natural jumpstart for most patients. Now, you definitely don't have to do any of these things. We can just wait for your baby to come on their own. But if you're a mom who's motivated to do what you can to try to get labor going, these are some safe options that might help you feel like you're doing what you can to get baby here on their own. Now, we do recommend you not start any of these things before 37 weeks, and some of these things can be a little stressful for your baby. So it's always good to talk to your doctor about what they recommend as far as trying these kind of home natural ways of jumpstarting your labor and making sure you're not taking on any unknown risks for your baby. But again, these things don't have tons of great evidence, but we also don't think they're necessarily harmful. And I think they can really help moms feel like they're doing what they can to prepare their body as best they can, hopefully allowing their body to go into labor naturally and potentially avoid going past their due date or needing an induction, or just helping their bodies have a smoother transition into labor. So let me know if I missed any remedies that worked for you. Drop some comments below. I hope that these videos are helping you really feel like you're ready to have your baby, you're ready to recover postpartum, and just building your confidence as you near the end of your pregnancy.